Macular degeneration is a condition that affects the retina of the eye. So the macula is the part that we focus what we're looking on, so that provides us with the detailed vision. So unfortunately, there isn't a lot of symptoms early on in the disease process, so that's why we really recommend and encourage people to have their eyes checked regularly. As the disease further progresses, individuals might find that overall their vision is a little blurrier, but more importantly that there's actually more blurrier patches in their vision, and they might notice some distortions. Some people notice some alterations in their color perception. A lot of people have difficulty with glare. So age-related macular degeneration affects older adults. It's right in the name. But those that are smokers are also higher risk. It also affects women more than men, and it also affects people with lighter coloring more than people with darker coloration. So there's two different types of macular degeneration, a dry form and a wet form. With the dry form, what's happening is there's some deposits underneath the retina that are causing those blurry patches and those distortions. With the dry form, the best form of treatment is vitamins, healthy diet, good exercise, improving heart health, not smoking, all important for both mitigating the risk and slowing down the progression of dry macular degeneration. Wet macular degeneration, on the other hand, occurs when there's the formation of new blood vessels underneath the retina. The problem with new blood vessels is that they tend to be leakier, so they will leak fluid or blood. Right? If that happens, then that could lead to a more sudden change in your vision, and that could actually lead to a more blind spot in your central vision. And when that happens, treatment that's available for that is injections. They're called anti-VEGF injections. So even in the worst case scenario where we're at the end stage of the disease, there are still a lot of things that we can do. So in addition to the treatment that I mentioned, there is management options in the form of low vision rehabilitation. So we will introduce things like a portable closed-circuit television, which magnifies, but it also enhances the contrast. Just recently in Ontario, the Highway Traffic Act was amended to allow for individuals with visual impairment to be able to drive with the use of bioptic telescopes. We have multiple different types of devices and strategies that we work with the individual to help them achieve their goals, so that we still maintain good quality of life regardless of the process and the disease that you're having.